Good afternoon and welcome to our media briefing. As this pandemic has continued, we've seen successes in some areas and frankly, we've had some challenges in other areas. Most recently, we have seen more of the latter. In recent days, we have seen our highest case count and also the highest number of deaths. And now, despite some early successes, California now has the highest state case numbers in the nation, even surpassing the state of New York. San Diego is better off than most counties in California, but the reality is that unless we start turning things around soon, we run the risk of seeing our hard work wiped out and going back to severe state-imposed restrictions or possibly even a shutdown. We have to start pulling together. Now, I realize we can preach togetherness all day up here, but it takes boots on the ground to get that word out. So to do that, we are forming a safe reopening compliance team that will help businesses, establishments, and people across the region to comply with our public health order and to help us slow down the spread of this virus. Now, to be clear, we know a lot of businesses, places, and people around already do that, and we are certainly grateful and very thankful for their compliance. But we are seeing continuing outbreaks at businesses and places where people gather, and we need to curtail those outbreaks. We have long had on our coronavirus website information and plans to help businesses safely reopen. But we realize the pandemic is always evolving and some businesses are simply unclear as to the rules regarding reopening, and so we hope to educate them and to work with them. This team will send people out to provide the education, but to also address public complaints and ensure compliance and enforcement. This is not going to be the carrot, this is going to be the carrot approach, not the stick approach. But, and I emphasize the word but, we still have the stick and other tools available to us, and we will use them if necessary. The details of the Safe Reopening Compliance Team are still being formulated, but we are talking to all the cities in the region about it so that they can also be a part of our team, so that we can get their input, and so that everybody will be on the same page. In fact, I'll be on a conference call with our local city managers after this press conference to gain their partnership and hopefully their cooperation. If we can be one San Diego, we can win San Diego. And with that, let me bring up Supervisor Fletcher.
Thank you, and good afternoon. While we do continue to ask the public for their help and support in the things that every individual San Diegan can do to slow the spread, avoiding large indoor crowds, utilizing face coverings, hand washing, we also work very hard here at the county every single day to tackle every challenge and obstacle that presents itself and do everything we can to sharpen our response and what we are doing as a county. In the early days, there was a big focus on PPE and ventilators and sharing data. In recent days and weeks, we've been tackling challenges around testing and improving the turnaround time. We know we have work to do on case investigators, and we're hiring. We talked about that on Monday, the additional efforts to more than double the number of case investigators. And as Chairman Cox just mentioned, we know that we have to do more around enforcement. There have been real challenges. For the overwhelming majority of entities that are open, that are doing the right thing, we say thank you. For those who need help and facilitation and education and clarification on the rules, we have a dedicated staff and team here at the county who works to answer questions and provide information and be a resource. But for those egregious violators, we recognize the need to step up and have a dedicated staffing, kind of code compliance type individuals focused on public health orders that can go out to egregious violations and report to those and investigate those and ensure compliance with what we're doing. The compliance is out of an effort to keep our businesses open. It's not out of an effort to punish anyone or harm anyone, but the simple reality is outbreaks and increase in cases impact the totality of our economy. And so for the overwhelming majority, we say thank you, but for those that are egregiously and flagrantly violating the public health orders, there will be in the works increased ability to provide more enforcement. As Chairman Cox also mentioned, we are working with the cities to designate folks and asking them to partner with us in hopes that we can collaboratively tackle these issues together in jurisdictions with the simple goal of slowing the spread, lowering the number of outbreaks, getting us off the state monitoring list, and allowing us to get the largest sections of our economy up and running as possible while we await a vaccine or therapeutic treatment to truly turn the corner on COVID-19. And so we will continue to work every single day to tackle and confront every challenge we face and do our level best to deliver for San Diego. In that same spirit, we've provided an update to our T3 chart. We want to try and make this information more relevant, more insightful, and give you a better insight in terms of what is happening in real time and what we're measuring and monitoring, and also aligning this as best we can with the state of California and what they hold us accountable to and what they look at and monitor. So I want to bring up first, I'm going to spend a little bit more time on this than we normally do. This is our revised T3 strategy chart. Under testing, we're still going to every day report the number of tests for that day on subsequent charts, but what you'll see right here is the 7-day average. We're going to be reporting on our T3 chart the 7-day average of daily tests reported. For stage 3 reopenings, the state of California asked that you're at 2 tests per 1,000 residents, and so we have adjusted our daily goal. It was previously at 1.5 per 1,000. We have adjusted it to 2 per 1,000, and you see that at the 6,600 number under the goal. So that goal is revised and new to be the more aggressive goal. And then above that, what you see is 9,155, which is our 7-day average of daily tests reported, and that's what will be reflected. We'll still report separately the individual day, but this is what we're really striving for, is the 7-day average. Underneath that, what you're looking at there is the 7-day average of percentage of positive for new cases. This is a metric the state of California monitors. The goal for that is to be under 8%. And you can see right now we are at 6%. Our subsequent charts report percentage of positive. The purple line, which you're used to seeing, is a 14-day rolling average. That is one thing we use internally here at the county, but the state looks at the 7-day average. Out of coincidence, today the 7-day and 14-day average are both exactly the same. They're both 6%, but what you'll see on this chart moving forward will be the 7-day average. Let's go back to T3, please. Will be the 7-day average of new cases, percentage of positive. And then below that, you'll see the cumulative number of tests reported, which we're now at 522,000 more than that. Under the tracing category, what you're going to see here is the 7-day average of investigations initiated within 24 hours. That's the top one. This is the one that we've talked about this week. This is below where we expect to be, and this represents the actions we're taking to more than double the number of case investigators. 97 additional case investigators are being hired this week alone. We're in the process of hiring 212 on top of that 97, and we think this number will continue to increase and go. But instead of just sharing the raw number of people we have, the goal is not a number of people. The goal is a percentage conducted within 24 hours, and so we want our charts to reflect the goal that we're driving towards. Below that, you'll see the 7-day average of close contacts being traced within 24 hours. 90%, that is our goal, and again, we're doing well on this. We have to increase our work on case investigations. And then the bottom is just the cumulative of total investigations performed to date. Under treat, we're running the 7-day average of individuals in our public health rooms. Again, a lot of this represents what we say here often, which is one day does not make a trend. We are looking for trends over time, and so we're trying to shift a little bit towards that trends over time. So 83, you still see the cumulative number of individuals in public health rooms. And then we've added an important metric below, which is the total doses of donated convalescent plasma. We moved early as a county to really embrace and adopt the value of convalescent plasma, and we want to thank the San Diego Blood Bank for what they've done. Any individual who has been positive or is suspected that they may have been positive, we encourage you to go to sandiegobloodbank.org. There they have a wealth of information about if you might be a candidate to donate convalescent plasma. They have 6 donor centers geographically dispersed throughout San Diego County, where individuals who know they are positive or suspect they were positive could go and potentially be candidates. Right now, the San Diego Blood Bank is out of convalescent plasma for San Diego County. And so we are asking every individual who knows they're positive, if you're willing to donate this, there is evidence that it is very helpful. The hospitals are in high demand to help treat individuals, and we strongly encourage you to go to sandiegobloodbank.org, get information on their website, see if you might be a candidate to donate convalescent plasma. And this is one way we can come together. Those who have been impacted by COVID can take some positive steps and actions to help those who are just coming into their experience with COVID-19. So this is our new T3 chart. This data will be updated daily, and we will share it at all of our press briefings. Now we'll move to the more traditional charts you're used to seeing. This is our daily totals. Again, there you see today we're reporting 8,280 total tests for today, 587 new positive cases reported today. That is 7% of all testing reported today is reported positive. The purple line you see represented there is a 14-day rolling average. It is sitting at 6%, which happens to be the same as the 7-day rolling average. And again, we would like to see that number come down. Next, on our hospital census, you can see a slight decrease in our ICU utilization. Total hospitalization, slight decrease there. Again, holding generally steady over the preceding 5 days. Next, we will go to our total hospital census. The COVID numbers there at the bottom, down just a little bit. Non-COVID numbers increasing, and so you see us at 4,311. Again, that 80% trigger or metric for hospital system capacity sitting at 4,902. And so we will continue to monitor and watch that. And then last one for me is our ICU utilization. Our COVID ICU utilization down just a little bit, non-COVID up a little bit, and holding steady there at 71%, where we have been for a little bit of time. That concludes my section of the report. I'll now turn it over to Dr. Wooten for her Public Health Officer's update.
Thank you, Supervisor Fletcher, and welcome everyone. Statistics for global, national, and state numbers are based on data that's retrieved from the Johns Hopkins dashboard and was obtained today around noon, as you'll see on this table. Today's County of San Diego statistics are from reports as of 11:59 yesterday. Today, as a result of those reports, we are reporting 2 new milestones, if you will. We are over 25,000 cases, 25,107, which is 587 more cases than yesterday, an increase in new cases since yesterday's report of 385 cases. The total includes 505 deaths, so we are over the 500 mark for deaths, and this includes 18 new deaths reported since yesterday. The age range is unchanged from 3 months to 102 years of age, and also for the age group 20 to 49 years of age, that is holding at 59% and represented by 14,735 cases. The gender also remains unchanged, with 51% of the total cases being female, 49% being male. 2,279, or 9% of the cases, have been hospitalized, and this includes 592 individuals that have been admitted to the ICU. This number is 2% of the total number of cases and represents 26% of the total number of those hospitalized. Again, there are 505 total deaths, which represents 2% of the total population. 224, or 44%, were female, 56%, or 281, were male, and 480, or 95% of the total deaths had underlying medical conditions. And as always, our sincerest sympathies and condolences go out to the family and friends of those reported today, as well as those individuals that were reported in the past of dying from COVID-19. So in the next 6 or 7 slides, we'd like to show COVID-19 demographics as it relates to cases, hospitalizations, ICUs, and deaths. On this slide, we are focusing on cases, and on the left side of the slide, in the last 3 weeks, cases have increased over those 3 weeks. Actually, last 4 weeks. If we look at the preceding weeks, that was the area where we had flattened the curve. Beginning in mid-June, numbers started to increase. So we will continue to closely monitor that. Until today's report, the prior 3 days were showing encouragement of a daily decrease, but today's new case count is 587. So again, we will continue to monitor. Over the past 4 weeks, if we go to the next slide, we'll see a history of all of the COVID-19 confirmed hospitalizations that have increased since mid-June, with some decline in the past few days. Again, we will continue to monitor those, and ICU cases are part of this. And if we go to the next slide, we are seeing an increase in ICUs. And let's go back to the last slide. This is actually another depiction of hospitalizations, and beginning in mid-June, we saw actually a nice increase, incline in hospitalizations. Again, we have some hope over the past several days. There appears to be a modest, very modest decline in hospitalizations, but again, we will continue to monitor. In this next slide, now we're on ICUs, and same thing in the 4 weeks on the left of the weekly reports. We saw increases from the prior 4 weeks, and we are seeing some decline, but yesterday there was an increase. So again, this will be continued to monitor. The good news is that hospitalizations and ICU admissions are maintaining or stabilizing or consistent for now, but again, we have to continue to monitor those. In the next slide, we focus on deaths. Again, similar trend in the 4 weeks from mid to late June through mid-July. Deaths were increasing, and we will continue to monitor. The 18th and 19th was the weekend, and usually they are not, usually 0 to very few deaths reported over the weekend. So again, we will continue to monitor this. In the next slide, this is our epi curve. So the epi curve shows increases in cases by onset of illness as of mid-June. And in the next slide, with the actions taken recently to limit indoor activities as a result of opening up various sectors, we hope to see the cases decrease. The goal, again, is to decrease the number of cases with the onset of illness for the 14-day period from July 8th to July 21st. Based on the actions that we have recently taken, what we hope to see is a decline in cases during that period. This is achievable if all of San Diegans, including individuals, businesses, and governments, comply with the recent orders from the state and help us to have compliance with the strategies that we are promoting, including wearing facial coverings as well as social distancing. So in the next slide, I'd like to provide an update on the 13 triggers, which determine if additional measures would be necessary to prevent the spread. And obviously, as a result of the fact that we are on the state's monitoring list, as indicated by trigger number 1, which is case rate, we are now reporting again 154.8 cases per 1,000 population. Yesterday, we were just under 150 in the 140s. So the trigger reflects, this trigger reflects the rate of cases per 100,000 for a 14-day period measured during the date of illness onset with a 3-day lag. And currently, as I stated, this rate is 154.8, which is increased since yesterday's rate of 149. In order for this metric to return to normal, we would have to have 234 cases or less on a daily basis for 14 days before this would return to less than 100. So changing this metric will depend on all of us doing our part, including individuals, all of our sector work sites, and governments. Again, we all have a role to play. In the next slide, we want to focus on trigger number 2, and this is related, we can go to the next slide. This is related to community outbreaks. And the trigger here is no more than 7 or 7 or more. If we have 7 or more community outbreaks in the past 7 days, this trigger is abnormal. We have had 53 or 48% of the 111 active outbreaks in community settings currently in place, and this excludes the other outbreaks such as SNFs and congregate care facilities. The outbreaks reported over the past 7 days include 12 total community outbreaks in community settings. And this includes 2 new community outbreaks reported today, and also 4 outbreaks fell off our outbreak list since yesterday. On this slide, we show the table for the various settings for the 12 outbreaks with the 2 new community settings, and one in a business and one in a healthcare setting. So the next trigger that we would like to share with you is related to case investigations, and this is trigger number 11. This trigger is met if 70% or less of investigators or investigations are initiated within 24 hours of notification over a 7-day period. Today's result is 9% of cases have been initiated within the first 24 hours of being assigned to a case investigator. This metric has declined because of the continued increased number of new cases, with a record high occurring on Friday where 634 cases were reported. In total, in order to address this issue, we will have 97 case investigators that will start taking case investigation assignments on Friday. And also, we've shared with you our recruitment process. As of close of business on Monday, we had received 4,386 applications for case investigators, and we are also continuing to recruit for contact investigators, as well as teams to go out and do outbreak assessments. So getting through this pandemic, it requires that we all do our part, as I have continuously stated just today alone. We want people to wash their hands, stay 6 feet apart from others, wear facial coverings, avoid crowds, and stay at home, particularly if you are sick. The time is now for everyone to take action and for everyone to play their role. So we are depending on everyone, every individual, every business, school, and all other sectors to play a role. Now please welcome back to the podium Chairman Greg Cox, who will continue our update today.
Thank you, Dr. Wooten. We'll go directly to the questions.
Brandon Lewis with CBS 8, please state your question.
Thank you. The Chicano Federation was calling on the county to increase the level of urgency reflected in its messaging to the Latino community about coronavirus. And last week, more than 1,000 CDC employees signed a petition demanding that the agency declare racism a public health crisis. So my question is if county health officials agree, based on the impact that coronavirus is having locally, that racism should be a public health crisis, and if there's a primary reason of why, despite the messaging that the county is putting forward, that coronavirus is still prevalent in the Latino community.
Okay, Dr. Wooten's going to respond, but as she's coming up here, let me just acknowledge that certainly we realize, particularly in the southern part of the county, it happens to be in my district, we are having significantly higher number of cases of COVID-19. The explanation for that's probably multifaceted. There's probably more essential workers in South County that are fulfilling jobs in various industries and locations. We're closer to the border, so I know we're picking up some people there. We've probably disproportionately gotten more people from Imperial County, and that certainly is an issue we're very concerned about, and that's one of the reasons why we've set up the number of testing sites that we have. And frankly, most of the majority of testing sites in San Diego County are in South County in order to help address that particular issue. But let me ask Dr. Wooten if she'd like to come up and elaborate more.
Thank you, Chairman Cox. I think there are several points to make here. First of all, I think we all can agree that racism or social injustice is a public health crisis. I don't think that there is a dispute about that. I am proud of the fact that the County of San Diego has had a focus on health equity for at least in our HHSA department or agency since 2008, when it was made a priority for our county. And also, we have an Office of Health Equity within public health. So since the beginning of this pandemic, we have made outreach to the Latino population as we looked at the data and determined that the Latino population had the largest number of cases associated with this pandemic. And even today, over 60% of the 25,000 are in the Latino population. So as a result of that, we've had a targeted or focused, rather, community outreach focusing on the Latino population with various phases of outreach through social media, through ads, and we are now beginning to launch phase 3 of our public education campaign, focusing on the Latino population. So we have known that this is an issue and have taken dedicated steps to address it.
Thank you. And if I could just ask one clarifying question about the data from the triggers map. The county has reported a case rate of 145 on July 20th. The state COVID site says the county was at 206 on the same day. The percentage of positives don't seem to be matching up. Is there a glitch on data-wise that we should be aware of?
Yes, I think we've shared with you previously that the positive tests, particularly that are being collected at the state walk-up sites, there's a inconsistency with the reporting there. So while it's not showing up on the state's website, our epidemiologists calculate that here and we send it up to the state. And it doesn't impact, however, the fact that individuals that test positive are still contacted and by our case investigators so that we can identify contacts of these cases.
Thank you.
Okay, we'll go to the next question.
Hunter Sowards with KOSI, please state your question.
Hi there. Yes, I'm wondering if we can get a little more information on the safe reopening compliance team. Obviously, this is in place to aid in getting us off the state's watch list, but I'm curious who is going to be on that team, and will law enforcement be directly involved? Is that how you'll be handling non-compliance? If we could just get more information on that.
Well, we do have a compliance officer. His name is Gary Johnson, who is working with businesses and individuals that call up with reports of people in violation of the public health order. He's doing a tremendous job, but we hope to, again, after today, solicit the support and cooperation of the cities in dealing with the whole compliance-related issue. But let me ask Dr. Wooten if she'd like to go ahead and cover that in a little more detail.
Thank you.
Thank you for identifying that question. We have been working over the past 2 weeks or so after our CAO directed staff to develop a compliance program. And we are developing the framework for that compliance program, and then we will be working with municipalities to become a part of a team that will address any complaints that are directed our way, as well as those complaints that are submitted to the 211 system. So we hopefully, our plan is to roll out what that will look like next week in one of our media briefings.
Thank you.
Mm-hmm.
Okay, we have one other call-in question. I just want to explain that Paul Sisson seems to be the last call-in every day. I don't know whether it's because he's slower than the others or because he waits to the very end, but the last call-in today is from Paul Sisson with the San Diego Union.
Paul, the microphone's yours.
Oh, thank you. I had a little further question on the safe reopening compliance team that you guys just addressed. I mean, you guys have been investigating complaints as they come in the past, right? I'm struggling to understand how this is any different than what you've already been doing. Can you kind of clarify exactly what's going to change here?
Well, let me acknowledge that when we've had gross violations, and we've had a few that we've picked up either because of call-ins or in some cases the media have picked it up and it's been on TV or talked about on the newspaper or radio. We've dealt with those, I think, very quickly and frankly very effectively. What we want to seek is compliance. And I know we had a situation last week with a church that was in direct violation of the new public health orders directed by the governor. Our compliance officer was able to sit down and work with folks at that particular church. I think they appear to be in compliance now. I think there was one or two other examples. But we know that there's other instances that are occurring in various parts of the county. And I think our effort now is going to be to try to work with the cities. Ultimately, they have the enforcement responsibility, at least in the incorporated cities. The county would have the responsibility in the unincorporated area. But again, we're not trying to use any heavy tactics. We want to get compliance, and we want people to be educated and understand where they're perhaps not in total compliance with the public health order from the governor. But I know that Dr. Wooten is here and probably has some additional comments.
Paul, thank you for the additional questions. If you look at this like an iceberg, what we have been dealing with for the very egregious cases, you're absolutely right, we have been dealing with those. But there are compliance issues associated with those businesses that might have outbreaks aside from the restaurants, because the Department of Environmental Health is taking the lead to conduct those assessments and ensure there is compliance. But there are other businesses where we have outbreaks, and we want to be able to work with the various municipalities as a team to go out and do the assessments. And then we might also want to include not just a complaint base, but we might want to look at just random assessments so that we can assess compliance across the board. But again, we've been dealing with the egregious cases, the more moderate cases. This will allow us to be more aggressive by working with the local jurisdictions throughout the county so that we can, as a team, look at compliance issues. Does that help to understand where we're trying to go?
Well, I thought that you were always working with individual municipalities. Certainly the county has no law enforcement powers, and cities with their own police departments, for example, or code enforcement divisions. So you've always had to work with local jurisdictions, I would think. I guess I'm just trying to understand, is this organization that's only focusing on outbreaks? You just talked about outbreaks quite a bit, but what I thought was it was just about compliance, not so much outbreaks, but practices, even if, that the businesses are taking, even if they haven't had cases associated with that.
Absolutely. Yes, but again, you are absolutely right. We've been working with other municipalities, but what we're trying to form is a team so that we have county staff, and depending on where the complaint is based, if it's in another jurisdiction outside of the unincorporated area, we will have county staff and a point of contact from that jurisdiction to go out and conduct assessments. So it's
So there's just gonna be a stronger
multi-level.
linkage between the cities and
Pardon?
the county. There might be a stronger linkage then between the city folks who would do this work and the county folks who would kind of oversee or assist with it?
That
fair
is
to say?
correct. That is correct.
Thank
Okay,
you.
thank you.
That completes our call-in questions. We do have a couple of text questions. The first one I'm going to ask Supervisor Fletcher if he'd like to come up and respond to. It's in regards to the governor's public health orders and to the degree of compliance that we've seen as a result of some of those changes over the last couple of days and weeks.
This text message is from Mike McKinnon from KUSI, and he asks, because Newsom's mandated closure of indoor operations haven't resulted in a decrease of cases, would San Diego County consider allowing businesses that are now closed to reopen if they follow safety protocols?
Thank you for that question. The governor put out the indoor restrictions on the 13th. Here in San Diego County, it was not in effect until the 15th, which is just 1 week ago. Those who follow this press briefing regularly will not be surprised that in 1 week's time there's not a significant impact in the cases. Those who don't follow may not, but as we've talked about multiple times on multiple occasions, there's a significant lag when you deal with COVID between when you take an action and when you see an outcome. It's often been described as a freight train that when it gets moving in terms of its spread, it is very hard to slow and it takes time. And so it is to be expected that the number of cases will not significantly decrease until some time after that action has been taken. So it is certainly our hope that in the coming weeks we will begin to see the numbers which have stabilized a bit in terms of percentage of positive begin to come down, and that we will see the positive impacts of those changes. We also hope to get greater public awareness. There's been a really irresponsible debate about the validity of face coverings, about the validity of public health scientists and data, and the effort in that, and we're certainly hoping that we can see greater public awareness and the importance of what we're doing out of an attempt to keep our businesses open. And all of the actions we take are designed to not only preserve life, but preserve our economy and keep it open and running as well. And then finally, state public health orders have the impact of law, and here in San Diego County we will follow them as we expect most other counties will do. Thank you.
This last text question deals with the issue of number of cases and primarily healthcare facilities, and Dr. Eric McDonald is going to respond to that question.
This is from Lindsay Winkley with the Union Tribune. Previously, Dr. McDonald has said that outbreaks that have occurred at healthcare locations were often made up of employees who may have, as an example, spent time together in a break room without masks. Is that trend true for outbreaks at all other community setting outbreak locations as well?
That's a great question. I think that it's hard to generalize, but I will say that because most businesses, especially healthcare and other businesses, actually have very strong policies and procedures in place in the physical place where people are working, and people tend to follow them. We've seen a trend that when we see an outbreak in that type of setting, they're often individuals who know each other and admittedly will be socializing outside the actual physical workplace where they're doing the work. So it might be in the break room, might be outside, might be because they're socializing together in the home environments or doing things together outside their households. So I think that is a bit of a trend, and it speaks to sort of human nature. When you're doing your work, you're kind of in the zone, and you're doing what you are asked to do with your policies and procedures. But sometimes when you're on a break, you let your guard down. And I think that is a common theme that I would pass on, that you can really never let your guard down with the coronavirus. And so the specific example I used before was in the healthcare environment. We've certainly seen that groups in other areas, whether it was law enforcement or businesses, there is that trend of people who know each other, not just at work, but outside the work environment.
That concludes our media calls for today. Before we close, I wanted to take an opportunity to acknowledge that today is officially the start of Comic-Con. And it's always been a great time of the year to see a lot of people, a lot of energy that's been generated at certain buzz that we see in this region that we don't ever normally see during the balance of the year. It brings families together and people dressed in some very colorful, elaborate costumes in downtown. Well, sadly, because of the pandemic, Comic-Con is online this year, and so we'll miss all the fun and the ongoings that go with that downtown. But we can celebrate the spirit of Comic-Con. I urge everyone to find their favorite inner superhero by doing one simple thing. Wear a mask. Many of our beloved superheroes wear masks when they're out fighting villains and trying to save the world. And you too can save the world by covering your face. So please, San Diego, mask up. That's it for today. We're not scheduled for another media briefing until next Monday at 2:30, but we will be back then. And as always, we ask you to check our coronavirus website for updates. And again, thank you, and stay safe, San Diego. Thank you.